Hello, everyone. I'm Dr. Monty Pal, your host of the ASCO Daily News podcast. I'm a medical oncologist, professor and vice chair of academic affairs at City of Hope in Los Angeles. Today, I'm really excited to share with you my takeaways on selected abstracts from day 3 of the ASCO Annual Meeting. We're going to cover a broad span of topics: advanced colorectal cancer, some exciting new data in metastatic prostate cancer. We're going to be talking about TILs in the context of non-uveal melanoma, some really exciting data there. And I'm also going to highlight an abstract that's gotten a ton of attention at this meeting, and that's an abstract looking at ultra-low dose immunotherapy in head and neck cancer. But why don't we go ahead and begin with the phase 3 clinical trial, abstract 3505, presented by Dr. Jin Lee from the Shanghai Go Abroad Cancer Hospital. Now, this abstract looked at the setting of colorectal cancer. This study involved the use of an antibody-drug conjugate targeting HER2, known as trastuzumab rezetecan. Now, we've all seen the data for HER2-directed therapy in the context of breast cancer and gastric cancer. This study was a randomized, open-label, multi-center study that looked at patients who had HER2-positive, RAS and RAF wild-type advanced colorectal cancer, and importantly, these patients had progressed after standard second-line therapy. They received either in a 2-to-1 fashion trastuzumab rezetecan or standard of care-based therapies. And if you're wondering what that standard of care represented, it could be TAS-102, it could be fruquintinib, it could be regorafenib, some of the therapies that we're used to seeing in that particular setting. They did stratify the randomization based on HER2 status and ECOG performance status, and their primary endpoint was progression-free survival. Ultimately, they actually randomized a total of 130 patients, again in that 2-to-1 fashion. About 71% of patients were HER2 IHC3+, and almost 60% had an ECOG performance status of 1. In this study, what they ultimately saw, and this is the bottom line, there was an improvement in progression-free survival. 5.5 months if we look at trastuzumab rezetecan versus just 2.8 months with standard of care therapy. With this early follow-up that they had in this study, they really couldn't say much about overall survival. It was immature. But having said that, it did appear as though there was a trend towards benefit there, with the hazard ratio of 0.77. Response rate, duration of response, all of these seem to be improved with trastuzumab rezetecan. And in terms of side effects, what we saw was that there seemed to be a broader array, perhaps, of side effects with trastuzumab rezetecan, but having said that, relatively balanced with standard of care. So ultimately, what we saw is that trastuzumab rezetecan improved progression-free survival and response rate. There seemed to be a trend towards improved overall survival. It's going to be interesting to see whether or not this agent makes headway here in the U.S. for patients with HER2-positive advanced colorectal cancer. This really does open up a relatively novel treatment paradigm. Another study that I thought was of interest was Abstract 5019. Now, this was presented by Dr. Kim Chi, who hails from the University of British Columbia. This study was one done by the Canadian Cancer Trials Group. This is a publicly funded agency, and this was known as PR21 and given affectionately the name the Pluto study. This randomized patients to receive either Pluvicto or docetaxel. Now, bear in mind the randomization in this trial. We've seen some of this data before. This looked at patients who had metastatic castration-resistant prostate cancer and randomized to either lutetium-177 or docetaxel, and there was actually crossover permitted at the time of radiographic progression. Now, if we look at patients, 199 in total, that were crossed over on therapy, one of the things that we actually see over the course of time is that the results really seem to vary a bit. The results of the study have been presented previously, and importantly, there didn't seem to be any significant difference in patients receiving lutetium-177 PSMA versus docetaxel. The hazard ratio was smack dab at 1.01, so no difference between the two. But the overall survival, because of this crossover effect, actually favored docetaxel with a hazard ratio of 1.64. As you can presume, it was probably fairly likely that given the option, patients who had access to lutetium-177 PSMA were going to cross over and receive it after progressing on docetaxel therapy. On the other hand, we actually didn't see quite as many patients who started with lutetium migrating over to docetaxel. Now, if you actually correct for that, and that's what they did in this abstract, if you account for that degree of crossover, you see that there's no difference in overall survival. And this abstract is really important because it really underscores the impact of crossover in interpreting the results of this study. If we account for the crossover, no difference in overall survival. If we don't account for that difference, the survival really seemed to favor, to some extent, docetaxel chemotherapy. Very, very interesting. The third abstract I wanted to cover, and this is really exciting, is done by Alison Betoff from Stanford. This is abstract 9507, and it looks at OBX115. Now, this is a very novel engineered tumor-infiltrating lymphocyte, or TIL. We've heard a lot about TILs in melanoma. This one is a bit different in that it's actually engineered to express IL-15, which is under the control of the small molecule acetazolamide, the same thing that we might use for motion sickness, for instance. And what's cool about this is that it actually limits the need for us to use high-dose interleukin-2. Those of us that have used high-dose interleukin-2 for melanoma or for renal cell carcinoma know the perils of that therapy. In this study, looking at this novel engineered TIL, what they ultimately saw was a response rate that I think was very impressive, a 67% response rate here. They actually achieved a CR in the context of patients with uveal melanoma. These are patients that really had been refractory to prior therapy and had limited treatment options. So what we saw in this setting is a response rate of 67% and a median follow-up of 18.6 weeks. The median duration of response was not yet reached. So very, very impressive data. And they're actually moving on to a phase 2 portion of this study and potentially a planned registrational study as well. So super exciting. I can't say I saved the best for last because these are all exciting abstracts, but I did want to highlight LBA 6007. This is presented by Dr. Shah from Tata Memorial Hospital. And in fact, this is an outstanding study led by their group in India. This study looked at the premise of taking conventional platinum-based chemotherapy, and it randomized patients to receive a regimen that included, and this is a complicated regimen here, oral methotrexate, celecoxib, erlotinib, and nivolumab. Now, this is not your standard nivolumab dosing. This is 20 milligrams IV every 3 weeks. Those of us that administer in the US, for instance, used a regimen of 480 milligrams, right? So that would technically amount to 24 times that every 4 weeks. What did they see in this study? Well, they randomized 422 patients across 2 Tata centers to this regimen. And ultimately, what they saw in this clinical trial was a significant benefit in overall survival, 10.3 months versus 6.2 months, and also a significant advantage in progression-free survival, 5.5 months versus 2.7 months. This is a very, very important study. And I'm going to highlight something the authors conclude with, which is that this regimen costs $230 per month. These are $230 per month. So you juxtapose that against the cost of care here. That really underscores just one of many reasons as this is big news. Well, thank you so much for listening today, and join me again tomorrow to hear top takeaways from ASCO 2026. If you value the insights that you hear on the ASCO Daily News podcast, please don't forget to rate, review, and subscribe wherever you get your podcasts. Thanks a ton.
The purpose of this podcast is to educate and to inform. This is not a substitute for professional medical care and is not intended for use in the diagnosis or treatment of individual conditions. Guests on this podcast express their own opinions, experience, and conclusions. Guest statements on the podcast do not express the opinions of ASCO. The mention of any product, service, organization, activity, or therapy should not be construed as an ASCO endorsement.